You know it's bad news when the doctor walks in, just with a very serious look and a bunch of paperwork. And her words were, "I'm so sorry. This is actually malignant."
Hello and welcome back. I'm super pumped about today's interview with my now friend Beth. Beth and I met online. She also lives maybe an hour away from me, so I knew right away that Beth was a very, very special person. And when she told me that her infusion nurses nominated her as an unsung hero, I'm like, well, of course, because she's amazing. And the fact that she's sharing her story here to help others is also a testimony to that. Beth is in the progress of writing her first book with her husband, so be on the lookout for that. So I'd like you to meet Beth.
Hi.
So, Beth, tell us a little bit about your story. I know this all happened very, very fast.
Basically, I was diagnosed on a Wednesday and then found out I was pregnant the following Sunday because my breast surgeon wanted to do an MRI, and we had said that there was a chance I could be pregnant. And so she told me to take a pregnancy test, and I did not get the MRI that Monday.
So, was there a lump or anything that led you to think that you had cancer?
I did not have a breast lump. I'm very unusual in that respect. I actually had something called Paget's disease of the nipple, which basically my breast cancer started as an ulceration of my left nipple. And so, fortunately, my obstetrician and gynecologist had really good sense. Many women, when they're so young, are not sent immediately, they're told to watch it. But for some reason, and she said, "I think you should go get a mammogram. You have family history." Both my grandmothers were two-time breast cancer survivors. And she sent me to get a mammogram. And I'll never forget sitting, having the actual mammogram done. And it was going very slowly. They were taking a lot of pictures, especially on my left side. And I immediately knew that they saw something that was not right, especially when the radiology tech said, "We want to get a couple more pictures. The radiologist wants to look at this." And then she said, "I want him to come talk to you."
Yeah, I think that's a part that people like probably can totally relate to because it is so scary sitting there knowing when someone actually needs to talk to you. It kind of starts to get a bit real at that moment.
Yes. As a 31-year-old, all I could think about was I was running late for my second period. I'm a high school teacher for school. And that was the only thing on my mind, that I was going to be late, not the fact that a radiologist wanted to talk to me about a mammogram. So he came in and he said, "I've been doing this a long time." He said, "I see calcifications in your breast," not even talking about the ulceration. He said, "Everything is telling me that you need to go get a biopsy." He said, "It may be nothing." He said, "But my experience is speaking otherwise." And I had mentioned to him that my husband and I had been trying to get pregnant again. And he said, "I think you need to stop." And so I went home to my husband. I was in tears.
There was another reason you had shared with me as far as why this was more painful for you. Tell us why.
We had been trying to get pregnant, had just started trying again. We unfortunately had suffered a miscarriage the following April. And so we had just started trying again to get pregnant in July. It was almost like going through that again because we wanted a family so badly. And I think the enormity of the situation, I really sat in that when he said, "I think you need to stop trying." So there was a week between my mammogram and the biopsy. And, you're kind of sitting in it. And I'm sure every woman is just, when there's such a large break, your mind races with, this can't be cancer. I'm 31 years old. I go to the doctor regularly. I go every year. I'm healthy. I was an avid runner. It there's no way this can't be cancer. I eat well. We're gonna leave this. It's gonna be fine. And it's bad news when it's not the nurse telling you. It's bad news when the doctor walks in, just with a very serious look and a bunch of paperwork. And her words were, "I'm so sorry. This is actually malignant."
So, what was going through your head?
The first thing I blurted out was I could be pregnant. And I told her that was the first words I blurted out. I hugged my husband. I was in absolute disbelief. I don't necessarily remember much of what they said.
So cancer is scary to start with, but now you're adding a whole nother layer of being pregnant on top of that. Were there any assurances that your medical team gave you to help guide you through and get you through being pregnant while having cancer?
They kept reassuring me that if I was pregnant, they were going to work around it. This was not going to be an issue to get the care that I needed.
Was that hard for you to believe, like, this is really going to work and everything's going to be okay?
That was constantly a question. How am I going to do this while I'm pregnant?
So let's talk about getting chemo while you're pregnant. What were your thoughts around that, knowing that there was this baby growing inside of you and you're getting this drug to kill cancer?
I was scared to death. My The recommendation for my breast surgeon was to an oncologist who had recently joined the hospital system just that year. But she had come from working in the Cleveland Clinic. And I don't know if you're familiar, the Cleveland Clinic actually has a clinic that they work specifically with pregnant patients or with cancer generally. But I asked her, I said, how does this work with chemotherapy? And she said to me, that in the second trimester, it has been found that the placenta does an incredible job filtering all of the cancer treatments. There is no residual effect on the baby, but they have to be very selective of the chemotherapy agents that they choose. So, for example, I'm HER2 positive. So the immunotherapy, Herceptin and Perjeta and Kadcyla that they would normally use immediately starting chemo, I would have to delay that until after delivery because they have not been proven safe in pregnancy. Carboplatin was another one that she said she did not feel comfortable using. So I ended up having adriamycin and Cytoxan and Taxol, all which are safe in pregnancy, but they are also the ones that have typically, especially adriamycin, have the most side effects when you're going through chemotherapy. And so, but she just kept telling me over and over again, I've treated pregnant patients. We have not seen a residual effects when we start treatment in the second trimester, which is why I had my unilateral mastectomy when I was in the first trimester and why I had my lumpectomy in the first trimester is because that is far safer than starting chemotherapy, which to me is still crazy.
Okay, so what trimester did you do adriamycin, Cytoxan, and Taxol?
I did it all. I did it in the second and third trimester. I started my first adriamycin and Cytoxan treatment at 20 and a half weeks pregnant. So I was at the midway point. My husband and I did a baby moon 3 days before we went. I started chemo and I just started feeling heart removed, which I feel like was such a blessing because I was able to feel her movements while I was going through chemo. I believe that was God.
So when I did my chemo treatments, my first AC, I went every 2 weeks. Was that different for you?
My oncologist made the decision to extend the treatment. So basically, instead of doing it every 2 weeks, I would do it every three weeks. So I did not have to have any, um, I guess, white blood cell boosters during it. Instead, she will let my body naturally kind of absorb and kind of fight back. And that ended up working out beautifully. So yeah, 4 rounds of adriamycin and Cytoxan, and then 2 rounds of Taxol. And then I took my 4 week break. And then my daughter was born.
Okay, so let's talk about the fun stuff. Your daughter, how old is she? How is she doing? And were there any issues along the way?
She is 20, almost 22 months old, which is totally crazy. I cannot believe she's going to be 2 in May. And she is absolutely perfect. We have seen no residual effects of any sort of chemotherapy that she had. She was born at 37 and 2 weeks. It was a scheduled induction. And she was very small, which they say sometimes happens when you're going through chemotherapy. There is some issue with size. She was 5 pounds 4 ounces at birth, basically off the chart. But she fortunately did not have to have any kind of NICU time whatsoever. Her lungs worked just fine. She fed normally, and now she is she's completely average in both height and weight. She's talking. Was an early walker at 12 months. She is she's incredible, and you would never know looking at this child what she went through, even before she was born.
Beth, I'm seriously like, I'm sitting here with goosebumps. Like, just hearing you talk and the success of all of this is truly amazing. All right, so tell me more about the decision to induce you at 37 weeks.
That was actually an incredible debate between my care team. Not only was I seeing my OB, I was also seeing a maternal fetal medicine specialist, who is basically looking over the shoulder of my oncologist, checking the care plan as we went. And so there was a discussion early on when the best time to deliver so I could get the Herceptin and Perjeta, because I couldn't have it when I was pregnant. Fortunately, they felt like they had done everything surgically. So my oncologist was a little bit more at ease about waiting until term to do that. And my maternal fetal medicine specialist thought she wanted to deliver at 34 weeks. So that was a discussion. But my oncologist was pretty adamant about waiting until the baby was term to avoid having her in the NICU, which I think was incredibly remarkable, and again solidified the fact why she was referred to me as my oncologist. And so, but they didn't want to wait until 40 weeks because they wanted to be able to restart chemotherapy. So it was just finding that sweet spot to
Yeah.
be able to figure it out.
There's so much that was being taken in consideration for you.
That was probably the hardest part, was just not only worrying about my own health, but worrying about hers. And looking back on it, I can't imagine the stress for all of the doctors involved also having to worry about that, and how everyone, I feel like when they saw Harper and met Harper, it was they took a breath once she was born and they knew she was healthy, because they were essentially treating two patients for a very, very long time.
So, Beth, let me ask you, what advice would you give other patients who are pregnant with a cancer diagnosis?
I would definitely, first of all, be very selective in your care team. If you feel like you're not satisfied with who you've selected because they lack experience with pregnant patients, I would definitely decide to get a second opinion. There are also a lot of groups on Facebook that specialize for women who are either diagnosed in pregnancy or diagnosed within the first year of breastfeeding as well. I would definitely pursue one of those. I know that was very helpful to me, because it's such a, not only are you young many times, but you're also pregnant, which are two things that don't happen. There's a 1 in 3,000 chance of being diagnosed with breast cancer during pregnancy. And so we are essentially unicorns. So I would say information is key. And if you don't feel right about what you're being told, you need to seek out somebody else, because mother's intuition kicks in very, very early in pregnancy. I think any pregnant woman, regardless of what they're going through, would agree with that if it feels like it's not sitting well with you, you need to go talk to somebody else.
What would you have done different during your journey?
I wish I would have met more women early on that were going through the same thing I was, because I felt very lonely. And when you walk into an infusion suite, bald and pregnant, it makes you feel even lonelier because people stare.
So, let's talk about you and just your health, mental health, all that stuff. Is there anything you would have done different during your journey as well as postpartum?
I do feel like I wish I would have invested in some of the emotional support earlier in my journey. I didn't realize how difficult it would be postpartum, um, in dealing with restarting chemotherapy, dealing with a newborn at home, on top of typical postpartum things. I suffered from clinical postpartum anxiety, right before I delivered, and then right after I delivered. A lot of my anxiety stemmed from Harper not wanting Harper to get sick, and I didn't seek any kind of emotional support until that point. Um, and that, I felt like I wish I would have started earlier, because when you're in it, you're just going to doctor's appointments, you're worried about the treatment plan, you're worried about this. But then after you deliver, it's all of that, I felt like, really caught up with me. And I felt like restarting chemotherapy, leaving Harper at home, with my husband, who was also absolutely exhausted. And for part of that, he fortunately got a little bit of time. He got about a month off after Harper was born, which I know is unheard of in some professions. But him having to restart work, I was just so scared that everything had gone so well um, through like Harper was fine, that I was so petrified that the other shoe would drop and something was going to happen to Harper. And I would definitely say get a therapist. When really at the start of diagnosis, I wish I would have done that earlier because it ended up being an incredible support for me postpartum.
I think that's really great advice for any cancer patient, pregnant or not. I don't think it's talked about enough because we go in and it's simply like, here's all your treatment to fight cancer. And then your mental health is like, well, what in the world is happening or what just happened? So I think that is 100% valid. And I definitely feel you on that. All right, Beth. So any final thoughts for cancer survivors out there?
There is so much hope with breast cancer in general, but there's so much hope with pregnant patients with breast cancer to have a healthy baby. So if you're watching this and you've just been diagnosed, please know I have my evidence right next door to me. She's napping right now in the other room, but very, very likely you're going to end up having an incredible miracle. And the women who walked this path before me have also said that you're going to end up with your miracle. So I want people to remember that.
Beth, thank you so much for your time today. I know this video is going to help other people through their journey as well. So thank you for being transparent with the difficulties, but also sharing the wonderful joy and the blessing that has come from this. Thanks, Beth.